Welcome to episode 32 of Inside Politics, for teens, by teens, where I explore the politics and issues impacting our generation. I'm your host, Christina Li, and today I'm focusing on global health policy. For this, I've invited Rachel Sadoff, senior at Harvard studying history and literature with a minor in global health and health policy, who is passionate about infectious diseases and social justice within public health discourse. Rachel, thank you so much for joining me today.
It's an absolute pleasure. Thank you for having me on.
Yeah, of course. So let's jump right in. So now that we are in the midst of the COVID-19 pandemic, and it's just like it's been just a constant factor in our existence at this point. So I guess I was wondering if you could talk about the politics of COVID-19 and why we've been so behind in addressing the pandemic.
Very good and very important question with so many intersecting factors. I would start by saying that many public health disasters and structural issues have been very quickly politicized in human history. You know, whose fault is it? We love pointing fingers. Who should be responding? And, you know, to what extent you have the right to do so, which is a big issue in America. You know, I should be able to choose whether or not I wear a mask. And in that sense, people have been very quick to capitalize on COVID to advance their political agendas. We've seen this a lot in the presidential election. We've seen local level political representatives adhering to the opinions and preferences of their constituencies, which can presumably help keep them in power and increase their chances of being reelected. And that very often doesn't coincide with the science that we already have. I'd also like to point out that international politics are often quickly forgotten as we talk about the political responses to COVID in America. I recently wrote about how international politics have shaped supply chains and distribution methods for personal protective equipment, PPE. We've seen how some countries are quick to accept subpar quality PPE. They overcharge, they refuse or delay shipments based on the political and diplomatic relationships between suppliers and buyers. And that, of course, is a really unfortunate and preventable interference in what should be a more utilitarian distribution system.
Yeah, definitely. So I guess for I guess it just happens that most of the time when we hear our news about COVID-19 and I guess how to fight it, it's been from our politicians. And I guess, do you want to talk a little bit about that?
Happy to. It's really unfortunate in this climate, given how polarized political parties have become, arguably more so than much of American history. When the government chooses to take on the challenge of addressing and mitigating the risks of public health disasters, they're usually able to be, these opinions are evidence-based and more, to some extent, trustworthy as a result. And so given that we're getting information from both parties that often differs along political lines, it's mixing up a lot of the information that people are getting. And so it's allowing people to choose what information they want to adhere to and respect. And to some extent, we've seen statistically that people who identify as Republican versus Democrat believe different misinformation. Republicans, for example, are more likely to believe that hydrochloroquine will protect them, or that they can trust social media over politicians in the CDC. And it's also unfortunate that scientists are being passed over in favor of these oversimplified, personally, more easy to digest messages from politicians. And some scientists have been upset by that. We've seen many Harvard researchers taking on the role of science communicators, which is exhausting for them and kind of unnecessary. They're so busy with their research, and here they are on Twitter shooting down trolls who find what they believe to be faults or loopholes in their research. And our reliance on politicians for accurate information is putting more burden and more stress on our scientific community to speak up and correct those statements when necessary.
Yeah, definitely. So I guess on a global, I guess like zooming out a little bit more on the general stage of global health policy and looking further than COVID-19. So I guess like what are the key issues at this point in current global health policy?
Varies so much between fields. You know, people who work in demography versus infectious diseases are facing such different types of issues and such different types of potential interventions, different funding structures. So all of those types of issues may be considered unique to fields, but climate change is going to impact every sector in the public health policy and global health policy communities. We're dealing with a much more globalized world, as we hear again and again during this pandemic, than we used to. And with that, we end up with many intersectional issues. We've seen how international diplomacy has shaped localized response. And with these intersectional issues, we need to account for climate change, which will affect everyone in different ways. And we can already predict some disparities based on past disasters and interventions. But one exciting way to address it has been increased attention paid to something called One Health. And it's the idea that every public health domain is to some extent shaped by the environment. You know, droughts and floods, but also you're looking at where people live and the hazards that come with living, for example, in the suburbs versus downtown metropolitan areas. And so One Health has been an exciting, response to this all-encompassing issue of climate change. Structural violence has also been brought to the fore in the last maybe decade in a way that is shaping these kinds of interventions and informing how we understand and interpret different kinds of issues. The idea that, it's not individuals, for example, who are just addicted to opioids. It's a lack of mental health resources. It's supply and demand, pricing, housing instability, and other kinds of structural factors that make people more susceptible to opioid addiction, just for one example, and stigmatization that comes with that is a relative factor in many different public health domains. And global health security is something I'm particularly interested in. The idea that, one country acting up without a treaty that will allow other countries to punish them or put them in line or, encourage them to do better is tricky as we globalize and everyone becomes wealthier, which is amazing. But enforcing global health security is going to be increasingly difficult going forward, I think.
Understood. So I know you're touching on how these issues all intersect, and also how you touched on how class also affects global health. So I guess looking towards intersectionality and global health, do you want to talk a little bit more about how these social identities intersect with global health policy?
Happy to. I'll probably start with American healthcare systems and how intersectional identities in particular can impact health outcomes, just because the American system is what I'm most familiar with. We see how structural violence tends to victimize and disadvantage minorities of every kind. Low-income people, may not be able to afford healthcare or access healthy foods, which leads to a bunch of pre-existing conditions that can intersect and lead to more poor health outcomes. We see how people of color are less likely to receive pain medications, particularly Black people, because doctors don't believe them. We've seen how people in the LGBTQIA+ spectrum are more nervous about seeking out healthcare. And of course, every time you postpone your healthcare, your condition becomes worse, and then it's more expensive, and that can drive people away as well. So much of structural violence tends to disadvantage minorities, particularly in the realm of socioeconomic status. On a global level, the concentration of power among great powers, or particularly wealthy or influential or diplomatically well-connected powers, may often exclude other nations and states. And with that, we should be paying very close attention to their needs and accommodate those needs. For example, in this political distribution of PPE, I believe some Eastern European country, I don't want to get this wrong, was not in the EU. And so they were outside of this trade distribution network of PPE, and they didn't get any masks or tests because they weren't producing any for months. And of course, the Global South is, participates in the UN General Assembly and all of that, but their needs may not be accounted for when the main players in global diplomatic negotiations are always the same.
Understood. So you've worked at some really incredible organizations. So could you talk about how you were able to successfully find these positions?
Very flattering. Thank you. Much of my job search relied on the incredible Harvard network. We've got a wonderful Office of Career Services and these fantastically rich job databases, but I also combed LinkedIn jobs and Google careers religiously. And in doing so, if you're Googling global health policy, entry-level internship, summer 2021, you're going to end up with, 4 results, and you don't like any of them because they're all in health insurance. So I found a wonderful tactic is to search by more specialized field or tangential keywords. So, instead of infectious diseases, I might look for malaria. And then you end up with an organization that mentions malaria in its job description, but the algorithm picked up on that. And so using tangential keywords is wonderful. And then, of course, you should rely on whatever professional networks you already have. I commonly looked back to past supervisors for advice. I'd say, hey, Mark, I'm looking at these 4 think tanks. Do you like any of them? Are they reputable? Are they trustworthy? Are they fun to work at? And he'd be like, not this one. Try this one instead. And that was really helpful as well.
Great. So for those high school students who are I guess following these issues, what would you advise them to do as these rules are being rewritten with regards to education, politics, and international development?
Fantastic question. And it's tricky for Gen Zers because we're so young right now to make substantive change. The first thing I'd recommend is reading up, not only on youth movements and, Vietnam War, for example, those kinds of protests, but with looking to history, acknowledging that we are coming to maturity in terms of, American political history is really unstable and incredibly polarized. And my parents are always saying, we promise this is not what America is. Like, this is really unusual, looking to the past and acknowledging how, with that kind of information, you can more critically read what's out there right now and stay well informed in what emerging issues are. With that, I think it's so important that we connect with people on the other sides of political spectrums. We need to get out of our social media echo chambers and our social in-person echo chambers by engaging in really complicated and emotionally laden, often, discussions with people we don't really like to talk to because we're so polarized from. So I think that's really important for millennials and Gen Zers. And then finally, there are some ways that I think we have a unique voice in the political landscape right now. Even if we can't donate, we can volunteer and raise awareness really efficiently. And we can reach out to each other in ways that historically have never really been possible before, organizing massive campaigns of sorts and getting other generations to donate or to vote. I think capitalizing on history and unique channels would be a fantastic place to start.
Yeah, definitely. All right, Rachel, thank you so much for joining me today. I really appreciate your insights. Stay safe, stay healthy, and I'll see everybody next time on Inside Politics. Hi, everyone. This is Christina. Thank you so much for watching Inside Politics, and please feel free to check out the rest of the interviews on my channel. See you next time.